This patient is an 80-year-old white male that presents with a cyst-like structure to the right side of his chest that appeared suddenly 2 weeks ago, shortly following a fever. There have been no further fevers noted, and there are no other cysts anywhere on his body. He has not been in contact with anyone that has similar symptoms. The patient and his wife originally thought the cyst was just a small pimple and were not concerned. The cyst has grown over the course of 2 weeks and has become more tender, especially to touch. The patient denies pruritus or peeling of the skin surrounding the cyst. The cyst can be described as red, swollen, and painful. The patient has not seen his dermatologist for this cyst, but has a history of multiple skin cancers that have been removed. The patient has not used any oral or topical medication for the cyst. The patient rates his pain at a 5 out of 10 when the cyst comes into contact with his clothes or if it is touched. His vital signs are as follows: blood pressure 146/81, temperature 98.4, heart rate 86, respirations 17, and O2 sat 98% on room air. The patient is well appearing, in good spirits, and in no acute distress. Physical findings include a 1 centimeter raised cyst to the upper right chest with no surrounding redness or heat. Induration is noted, and the border is circular with irregularities. There is crusting to the top without discharge. It is tender with palpation and is non-movable. Differential diagnosis for this patient include a pilar cyst, a dermoid cyst, or a fibrous tissue tumor. Although most sebaceous cysts are generally benign, the most concerning diagnosis would be a malignancy, given this patient's history of recurring skin cancer. The plan for this patient includes a punch biopsy, with the specimen sent out to a pathology lab. The cyst was cleaned with betadine and numbed with 1 milliliter of injectable lidocaine at the site. A number 11 blade was used to create a small incision, and a punch tool was used to collect the specimen. There was no pus or discharge noted from the cyst. Estimated blood loss was less than 3 milliliters, and bleeding was controlled with a silver nitrate stick. The wound was dressed with a Band-Aid. The patient was instructed to monitor for signs and symptoms of infection and to follow up with his dermatologist as soon as possible. The patient was also educated on limiting sun exposure and using a broad-spectrum sunscreen. A week later, the pathology lab results revealed the cyst was malignant melanoma.